Hello and welcome to this new episode or this new video. So today we are going to talk about Guillain-Barré Syndrome or GBS. And we see that there is a lot of cases of GBS especially in Pune. The incidence of GBS is rising. So we see that there are adults as well as children who can be affected from GBS. So today I have a very good friend of mine, Dr. Rushikesh Damle, the pediatrician practicing in Pune, and he especially made up out some time to answer few of our queries about GBS in children. So welcome Rushikesh. Thank you for joining this video. And
Yeah,
I straight away like to begin and ask you, please tell us what is GBS and how is it different from GBS in adults?
okay. So thanks, Abhay. Thank you for inviting me in this live session. We are seeing increased number of cases in Pune, especially in Sinhagad Road area. So this is Guillain-Barré syndrome is an autoimmune. It's a immunological disorder where there is a antigenic cross reactivity of a virus with peripheral nerves. So it basically affects your peripheral nerves and paralyzes the muscles. So basically, muscles get affected by paralysis, and there is a tingling, numbness, paresthesias, and muscle weakness, which is noted. Clinical features in adults and children they are the same, but more number of children they are affected than adults.
Okay. So, what makes it more prone? Why are children more prone, and what are the triggers of this problem?
So basically, main triggers are the viral infections, all sorts of viral infection. Children they attend the creche, then schools where they catch viral infection. Then there are vaccinations which are going on, viral and bacterial vaccination. Then surgery, trauma, and outside food ingestion. So all these are triggers where virus gets introduced into your immune system, and it excites the immune system against the peripheral nerves. So why children they are more affected? Because they catch viral infections very fast because of schools and creches, all those things, and outside food ingestion.
Yes. So, outside food seems to be a very important factor. And a lot of these cases that are seen in adults also, they have some history of eating food which is cooked unhygienically and so on. So, can you elaborate on this a bit more? Because the chances of children eating outside food is a bit rare than adults, probably. So, can you tell us more about this?
So any stored food, canned food, fast food, this is the world where we eat fast food, canned food,
Yeah.
so they can get contaminated.
Okay.
Even if you eat contaminated water, contaminated canned food, or honey, it can affect children. And
Okay.
children, it is a ritual. We give honey to our
Yes.
children, so
Okay.
the bacteria and viruses can enter the immune system, our body, by eating this contaminated water, honey, canned food, which
Okay.
is very common.
Okay. So tell us, Rishikesh, are there any particular investigations or tests that we need to do with the help of which we will understand that this is GBS or this is something else, or how do we diagnose it?
So GBS is basically a clinical diagnosis. It presents as acute flaccid paralysis.
Okay.
So there's no need of any investigation as such, but a simple, bedside single breath count test can be administered. Means if you take a deep inspiration, you are supposed to count 1, 2, 3 like that. Till you need to take another breath to count further. So now in normal child or normal adult can count more than 20. So if your count is 5 or less, it is very high risk for your diaphragm and respiratory muscles are paralyzed, and you
Okay.
need an intubation and a ventilator management.
Okay.
So this is a basic, and basically it presents with acute flaccid paralysis, and it's a ascending type of paralysis. Means the
Yes.
lower limb, the
Okay.
legs get in first, then the back muscles, and finally the diaphragm. So nearest differential diagnosis we consider is poliomyelitis, and nowadays even botulinum toxin. But in botulinum toxin, it's because of eating contaminated honey. If you
Okay.
have that Clostridium botulinum gets introduced in our body, and it is ascending type of paralysis, means upper limb gets involved first and then the diaphragm. But clinical presentation is almost the same. So
Okay.
in current epidemic, what we see is Campylobacter jejuni is an organism which is involved in this GBS, epidemic.
Hmm. So, is there any difference between the two where in one case you see ascending paralysis and in the other case probably there is descending paralysis, right?
Yes,
Okay,
yes.
so it goes from up to down, and both could be because of viral infections. Yes, okay. So, what would you tell our audience about the key symptoms that are there to watch for? What is it that, will tell us that the disease is progressing? Because, like you said, viral infections are very common. Children are going to preschool and creche and all these places where they are very prone to catch these infections. So, how do I know that my child has caught an infection? And what will tell me if it is actually progressing to GBS or something similar?
So as I have said earlier, it's a immunological disorder where it affects the nerves. So just like computer, you have input, you have a central processing unit, and there is a output. So the input is your virus. The central processing unit where it affects the brain and spinal cord. In spinal cord, there are anterior horn cell which affects the motor pathway, while posterior horn cell they affect the sensory pathway. So peripheral nerve has a myelin sheath, and what this virus does is there is an antireogenic cross reactivity of this virus with that myelin sheath. So our own antibodies they damage those myelin sheath. So if anterior horn cells are involved, then motor type of paralysis means muscle gets involved. There is a muscle weakness, and if there is sensory nerve involvement, then there will be tingling, numbness, paresthesias, temperature dysregulation sort of thing.
Mm.
And clinical sign where you see there is a progression means, as I said, GBS is a ascending type of paralysis. Your lower limb gets involved first, then the back and tummy muscles, and finally the diaphragm, which is devastating sign, because if your diaphragm gets involved, what we don't have any option but to intubate and start the ventilator treatment. So progression is, ascending paralysis means lower limb, then the back muscles and the diaphragm. So if the diaphragm gets involved, it is a sure short sign that the disease is progressive.
Okay. And so the first things that should create doubt in my mind as a parent would be probably that if the child is complaining of weakness, which is not in proportion to the exertion that he or she is doing, or then typically having tingling numbness, right, in their extremities, and or there is history of something like food poisoning or something after which all this has started. So that is something which I should keep in mind, right?
To summarize, history of outside food ingestion, contaminated water and food, followed by, your presentation is like diarrhea and vomiting, and where there is a gap, and then there is a neurological involvement in the form of paralysis and tingling numbness. So there is diarrhea, fever, loose motions, vomiting, and then there is the onset of paralysis.
Okay, okay. So
Symptoms of this, and then the neurological symptoms, which is due to autoimmunity.
right, right. So, when we think of autoimmunity and so many other factors that we are talking about, particularly right now, of course, one answer is to improve the immunity of the child in long term, of course. But what are the treatment options available currently? How do we treat the child? Because we know that many a times, parents just tend to buy something over the counter, give crocin, give Calpol or something like that, and then the patient may come to you at a later stage. So, what treatment options and how early should the child be treated?
Okay. So, as I said, this is ascending type of paralysis. Once you know that this is GBS, the treatment options are very limited. If your diaphragm gets involved, you have to intubate a patient. and start with IVIG. So this is a immunological disorder where abnormal antibodies are generated. So we need to remove antibody from the system. For that, you require a plasmapheresis where actual antibodies are removed. And then IVIG, IV immunoglobulins. So artificial immunoglobulins are given so that they block the immune system and those antibodies are destroyed. So these are the only two therapeutic options we have. And then as a prevention is always better than cure. For a disease like GBS, which is life threatening, prevention will always be better than cure. So avoid outside in such scenario. Avoid outside food, outside water, and contaminated honey. That particularly should be avoided.
Okay, and as you said that artificial immunoglobulins should be are needed to be given and so on. So always there are parents who feel, that whether there are any adverse effects or long-term impacts of these kind of treatments. What would you say about that? Of course, the child health of the child at that point is paramount. So we may give that, to the child. But then what are the long-term effects of that?
Usually IVIG, and if you give any antibodies, it does paralyze our own immune system, and it requires around 3 months for a child's normal immune system to recover.
How many
So
months?
basically 3 months, three
3 months.
months.
Okay, yes.
Yeah, because you are giving artificial antibodies from outside and they are destroying our own antibodies. So our own immune system gets affected,
Right.
and the child will be prone for more infections.
Hmm.
So it will take at least 90 days to recover their own, his or her own immune normal immune system.
Hmm.
So basic side effect is affection of the immunity.
Okay, okay. And is there any kind of restrictions that you would put on these children as far as activity and things are concerned, or any other precaution that the parents need to take when they have a child who has this kind of a disease at home?
So, normal rate of recovery once the child gets paralyzed for first month it is 41%. So that means if I don't treat, if there is diaphragm is not involved, there is no need of giving IVIG. Usually they are self, they recover on their own. So for the first month it is 41% self recovery, and 92% in the third month. So by and large, at the end of 3 months, these muscles they recover on their own, and child can start his or her own activity. But for 3 months, if the child is paralyzed for first month, second month, third month, you require a certain kind of support.
Okay.
Support in day-to-day activities, because my legs are involved, my legs are paralyzed. In
Hmm.
day activities also, I will require a support. So this support system at least for 3 months is required till the patient gets his own muscle power back.
Okay. Yes. Okay. Fine. Um, Now, as far as GBS is concerned, we also in homeopathy we do find that we can treat such cases. So I would
At
like,
if homeopathy, I want to use homeopathy in these cases like botulinum toxin, for example,
yes,
GBS. From homeopathic perspective, the treatment is different, or the same. For example, ascending paralysis, descending paralysis, in two
right,
different, we are talking two different diseases and
right,
two different, but the cluster is same.
yes.
So homeopathic perspective, treatment remains the same, or it is different for these two cases?
No, so that is a very good question that you have asked, because in homeopathy, we believe in individualization. So we see that any kind of disease, right now, also, let's say GBS, there will be a common set of symptoms that the patients will come to. But when the patient comes to us, what we try to find out is what is very peculiar in this particular patient. What is it that makes this particular child or adult stand out from all the other cases that we are seeing. So we inquire into the thirst, we inquire into the weakness that the patient has, we inquire into the exposure history, all of this. And especially in children, what we see is many times the children are not able to tell us. but their parents also will tell us that whether whether the child is irritable, whether the child wants to be carried around, how the child feels better. So all of these things are taken into account. And of course, we have different remedies. We do the remedy differentiation based on these PQRS symptoms, the state of the patient, the temperament, whether he's active, dull, and rightly, as you said, the paralysis. So we have different remedies for ascending paralysis, different remedies for descending paralysis. So we take all of this information into account. And I would also like to highlight here that what we do is, we never say that whatever treatment is going on for the child right now, we need to stop it. So whether the child is on any allopathic kind of treatment, we still continue that, and we give our remedies as a complementary to whatever treatment is being done. And we have seen in the past also in many viral infections like this, that when we complement in this manner, when we pay attention to the vital signs, those are taken care of. And in addition to that, we give something for
Especially,
immune recovery.
especially as I said, ki once the child is out of the ventilator, now the
Yes,
child goes home, but the muscle power is not up to the
yes,
mark.
exactly.
Requires 3 months to recover.
Right.
So, is the role of homeopathy in those, recovery period?
Yes, yes, absolutely. That is what I was trying to tell you. So, in the recovery period, also, see, homeopathy works on building the immunity of the child. So, as you rightly said, that it takes around 3 months, even if we give immunoglobulins, it takes around 3 months. So, these 3 months are really vital. In these 3 months, we can give specific remedies also and constitutional remedy depending on the child, so that the vital energy of that child improves, and thereby his immune response also improves. So there is really a lot that even homeopathy can do in such cases. Yes. So there are specific remedies which I can give names, but as I always say, one should always consult the doctor and take a proper consultation, and only then take remedies, whether it is homeopathy or whether it is allopathy or whatever. We should avoid giving remedies over the counter, because we don't know how the person may respond to that particular remedy. Okay.
Okay, so home messages of this talk is basically avoid outside food, outside water, contaminated food, and contaminated honey. GBS is basically diagnosed clinically by ascending paralysis and involvement of a diaphragm, and typical clinical features like tingling, numbness. IVIG and plasmapheresis is the mainstay of the treatment, and recovery period is around 3 months for complete recovery of the body's immune system. And allopathy as well as homeopathy will help you out to recover and faster and smoother recovery of a child and adult patient.
Yes,
Thank you.
thank you very much, Rushikesh, for taking out time. And I'm sure that this video, a lot of our patients will find this video very informative. And thank you so much for being there. Thank you. Bye bye.